Dr. Graham Dobson, thank you so much for sitting down and joining us. You have been a doctor of chiropractic for many years now. I've heard so many great things about you in the upper cervical community, and it's a pleasure to sit down with you today because not only are you an upper cervical doctor, you do other techniques to just help your patients hold, and you're doing some great work. I know you've been with a couple of Olympic teams in the New Zealand, and I'm just excited to get your story and share your experiences with chiropractic. Dr. Graham, how are you today?
Very good, Kevin, and thanks for having me.
Absolutely. So, Dr. Graham, where are you from originally?
From New Zealand.
New Zealand.
Auckland, New Zealand.
I hear that is one of the most beautiful countries on the planet.
Yeah, we're very blessed with what we have here.
Beautiful. And what were you into growing up?
I was into sports primarily, rugby and swimming. So in my teens, I had several concussions.
Yeah.
And by the time I was in my late teens, I was getting severe migraine headaches and just wasn't expressing health very well at all. So lots of susceptibility to upper respiratory infections and flus and things like that. And eventually the medic gave up on me and said, I don't know what else I can do to help you. And a family friend said, why don't you go see my friend who's a chiropractor? And I thought, well, I've got nothing to lose. I'll go do that. And it turned out that the chiropractor was he was a fantastic guy. He was a very good communicator and a very good technician as well. He was about a early 1950s graduate of Palmer College,
Nice.
Palmer School in those days. And he explained a little bit about what chiropractic was about, which intrigued me, and took x-rays, did an examination. And then I came back a couple of days later for my report of findings and first adjustment. And the first adjustment I ever had was a toggle recoil adjustment.
Beautiful.
And he explained what that was all about. And on the report of findings visit, he really connected with me in terms of explaining why I had lost my health. And it just made perfect sense to me because there was no answers coming from anybody else. And so even on that visit, second visit, I said, this makes so much sense to me. What do I have to do to become a chiropractor? So the light bulb went on right then and there.
How was that first adjustment for you? What was your experience with that?
Nothing much at that point, but within a few days, I felt like things were beginning to shift and change.
Yeah.
And so within a month, I was a different person altogether. And I was only like, what was I, 22 or something like that. Yeah.
And what were you thinking about before that day as a profession? Were you thinking about going into something else or?
Yeah, I was looking for what I wanted to do with my life, and I hadn't found it at that point.
Perfect.
Yeah.
Were there any chiropractic schools in New Zealand then that you could attend, or did you have to go to the States or somewhere else?
I had a choice of going to the States, Canada, or UK.
Beautiful.
Yeah.
And you chose Davenport, Iowa?
I did, yeah.
How was your experience in the States? Did you like it?
Yeah, I really loved it because I hadn't even been out of New Zealand ever before. And it was a big adventure.
Did you play rugby for them?
I did. Yeah.
Nice.
And I played 2 seasons, and then I thought, this is silly. I might wreck myself and not be able to ever do anything in practice. And so I retired gracefully from rugby at that point.
And what were your thoughts going through school? Were you just looking at the toggle recoil technique that got you better? Did other avenues open for you that you wanted to incorporate in your practice to help people? What was your experience like through school?
I was there to just soak everything up, really.
Yeah.
And to learn as much as I could. The chiropractor, my first chiropractor, gave me Stevenson's philosophy textbook to read before I went to Palmer. So although it was a difficult read for me, I read about half of it before I got there. and we had some really good discussions about what that was about. So I felt like I had somewhat of a grounding in the philosophy of chiropractic before I went to Palmer. So that was the thing that really gripped me, was what really was underlying the purpose of chiropractic.
Now, Graham, you hear that expression a lot, and for patients, what does that even really mean, the philosophy of chiropractic? What does that mean for you?
It means the why of what chiropractors do. It's not the how or the what, but it's all about the purpose.
And what is the why?
The why is that chiropractic helps to set loose the innate potential of the human being, or anyone with a spine, really. It can be animals as well. So it's all about freeing up the nervous system from interference so that the body and the mind can express itself in the way it was designed to do in the first place. Remove that interference and watch things happen.
Beautiful. And you see a lot of miracles happen when the interference is removed. Now, Doc, after graduation, did you head back to New Zealand and start with practice?
Yes, I did that. Or actually, I became an associate. I had no idea what I was going to do when I got back. I thought I'd set up a little practice somewhere. But on my second day back in New Zealand, I received a phone call from the busiest chiropractor in Auckland, the biggest city in New Zealand. And he said, "What are your plans?" And I said, "Well, I don't know yet."
Yeah,
come
just got back.
Come and have a talk. Come and have a talk. So I ended up going to work for him and with him. And it turned out that he was an upper cervically focused practitioner who also did some full spine technique, particularly Gonstead. And but it was mainly upper cervical pattern analysis using thermography. It was the Neuro that he used in those days. And so I had a lot to learn, because I really
a lot of specific adjustments going on in that office.
Absolutely, yes. And also monitoring the full spine, the lower spine, to see what changes were occurring. And if anything looked like it wasn't changing over a period of time, then he would look at adjusting lower, but not until he'd given the body a decent chance to change.
Beautiful. And so how long did you end up practicing with that doctor for?
2 years.
2 years. And then what did you do?
Well, in my second year with him, I started a part-time practice in another part of the country, just, about an hour drive away, north of the city. And I decided that's where I wanted to eventually live, bring up a family. And so after 2 years, I moved there full time.
What's the chiropractic culture like in New Zealand? Is it very similar to the United States?
It's somewhat different, because we don't really have insurance coverage to any great degree. So we do have something called accident compensation, which compensates the citizens of New Zealand and even visitors to New Zealand for injuries caused by accident, and it's a no-fault insurance kind of plan. And so chiropractors have been included in that since 1983. And incidentally, chiropractors have been a registered profession, which is our way of saying licensed profession in New Zealand, since 1960. So very early on, it was gaining a footing. Still a lot of resistance from the medical field, but gradually that has diminished. And but I wouldn't say it's a happy alliance by any means, just the same as anywhere else. But essentially, most practices would be cash-based, with a smattering of accident compensation cases as well. I gave up on the accident compensation deal about 20 years ago. There was just way too much control from them and interference from them as far as how you ran your practice, way too much paperwork and that sort of thing. So I've had a cash practice for the last 20 years.
And were you always able to take x-rays and images, or was that difficult for you as well?
Yeah, I could always take
Beautiful.
X-rays and images. In my first practice here in New Zealand, which I had for 20 years, I had my own X-ray setup.
Dr. Graham, how important is it if you're looking for a specific chiropractic adjustment, is it to have the imaging? Because
Oh, so,
I have a lot of patients that come to my office and, oh, I've never had chiropractor take an X-ray before my neck. How do you feel about imaging and specific chiropractic adjustments?
yeah, you got to see it to understand it, and everybody's different. Although basically spines are the same, individual differences are just so important, and the imaging gives you a fantastic insight into that. And I wouldn't like to practice without imaging. These days, I've moved along to cone beam CT scans for the upper and cervical analysis, and that's made a huge leap forward as well. I much prefer that over X-ray.
It's pretty incredible what you can see compared from a flat image to a three-dimensional image, what's going on in the person's neck. It's changed the way I practice, and it's changed the results in my practice for sure. Definitely
Yeah, me
a lot
too.
more people getting better. It's pretty amazing to see.
Yeah.
Doc, can you dive into a little bit of your time with the New Zealand Olympic team? How did that even
Yes.
come about?
Well, it's an interesting story. In New Zealand, we have a lot of beaches, and we have something called Surf Lifesaving. It's an organization in New Zealand and Australia and in some other countries around the world which provides lifeguard services, but it's mostly voluntary. And so we lived in a beach suburb, and there was a local surf lifesaving club there. We got our kids involved in that, and I got involved on the administrative side and that sort of thing. And so my son, Chris, who incidentally, both my kids are chiropractors. My son, Chris, said one day, I think he was about 14 or thereabouts. He said, there's a board paddling clinic going to be held at a beach down the country, and I'd love to go. Shall we go? And I said, yeah, let's go. So it was a father and son adventure for the weekend. The guy who was putting on the clinic was an Olympian, and he was a kayak paddler. And I'd heard of him, but never met him before. When he found out I was a chiropractor, he said, look, I know I've got a problem in my neck. I'm having headaches. I've never had headaches in my life before. I'm off balance. I've lost my speed in my sports performance. And could you have a look at me? So right there on the beach,
Wow.
I had a little bit of a look and said, yeah, you've got an upper cervical problem. There's no doubt about that.
Did you adjust them right there on the beach, or did
you wait? Come to my office on Monday, and he was there.
Nice.
So within a month, he was up and running like he was before, and probably better than he was before. And he had already won Olympic medals in 1984. This was 1986, and so after a couple of years of interacting with those guys, because one of his other team members was a 3 gold medal Olympic champion in 1984. And he came to me after I'd seen that first guy for about a month and said, look, I'm so impressed with what you've done with him. Maybe you could help me. He said, at the World Championships last year, I woke up on the first morning of competition. I couldn't turn my head to the right.
Oh, geez.
This was about a year later. And he said, I still can't turn my head to the right.
Wow.
So we got him sorted out as well. And then pretty soon the rest of the team was under care as well. I never charged them. It was just a delight to be involved with them. And I had some wonderful experiences traveling to world championships and around the world, and to 2 Olympic Games ultimately as well.
What did you need to bring with you in order to treat an Olympic team? Because obviously in your office, you have the x-rays, you have the equipment. What did you bring to the Olympics to treat those athletes?
Because of the fact they were already under my care, all those guys I was taking care of, I had all their records, you see. So all I needed was a portable table.
Nice.
With a drop headpiece on it. I also did some full spine work for them as well, as I do. And but it was really a major focus on the upper cervical spine. And the reason they wanted me involved is because what they noticed was they had less injuries when they were under regular chiropractic care. They also felt they performed better. They're on top of things, and so they love that. Of course, everybody wants an edge when you're an elite
Absolutely.
athlete.
You
Yeah.
look on any sideline today, any professional athlete, football, hockey, baseball, anything. There's usually a chiropractor on the sideline now, and you even see them getting adjustments before, during, and after the game, which it's come a long way, which it's nice to see.
That's true. Yeah.
Doc, I also wanted to talk about, we both know that the upper cervical spine, you see a lot of miracles happen, and it's phenomenal work, and it's so humbling to be a part of. But you also do full spine chiropractic, which is also amazing, and you do get phenomenal results. What kind of full spine work do you do to help support the upper cervical work?
Well, the first 20 years or so, I combined upper cervical with diversified adjusting very selectively, also some SOT, and but it was mainly to do with the pelvis and the upper cervical spine and watching what happened in between. Top priority was the upper cervical. Next priority was sacrum, particularly, because both of those areas have dural attachments, as you know, and that has a huge global effect on the entire spinal system, spinal neural system. So that was my main focus: the pelvis and the upper cervical. Then watching what changes occurred as a result of doing that, and anything that eventually looked like it wasn't going to be changed by the body, it was struggling, then I would adjust in other areas as well, but very, very conservatively. I think one of the biggest mistakes in chiropractic is to do too much.
Absolutely.
Do way too much. Yeah. Not giving the body credit for being intelligent, which we say it is.
At what point in your practice do you start looking at the sacrum and other parts of the body to adjust?
Yeah, I did that because that's what the first chiropractor that I worked with was doing. So he was my mentor for many years, and I loved the way he practiced, and the results and the types of people he attracted to his practice was just phenomenal. So I thought, well, why would I do anything else? After I did 20 years in practice, I sold the practice. Incidentally, I should tell you that halfway through that gig, I was on the faculty of Sherman College in South Carolina. And,
so you sold the practice to move to South Carolina?
No, I actually sold it to move to LA.
Really?
Yeah. So, but I leased my practice to another chiropractor about seven or 8 years into practice, and went to Sherman. I was teaching on the faculty there, so I'd always wanted to teach, and they gave me an opportunity. I taught upper cervical X-ray analysis, which I had become quite expert in due to my mentor, and also thermographic analysis, patterning, and then was supervising in the student clinic as well. And I had several different administrative positions at the college as well, assistant to the president first, and then dean of clinical science. So that was a very a huge growth period for me in terms of the academic side of chiropractic, and I learned so much. But then one of the other reasons we were there is my wife wanted to become a chiropractor as well, so she went through the program. Yeah.
Really?
And then then we came back to New Zealand and resumed practice where we left off before for 10 years, and then sold and went to join the Southern California College of Chiropractic in Los Angeles.
That's where I went.
And Southern California?
Yeah.
You went to Southern California College of Health Sciences, right?
That's right. Yeah. Yeah.
So the former LACC.
Exactly. Yeah.
Yeah. Well, I was in another college called Southern California College of Chiropractic, which was previously Pasadena College.
Gotcha.
And it was an attempt to establish a straight chiropractic college in California. And due to political maneuverings and that sort of thing, it eventually had to close down.
Mm.
So we were really on a roll there. It was going well, and then it just collapsed. And that
What
was
happened?
Well, it was I don't know if you remember, but at that stage we had two accrediting agencies for chiropractic. There was the CCE and SCASA, and SCASA was the Straight Chiropractic Academic Standards Association. So we were accredited by them along with Sherman and Pennsylvania College of Straight Chiropractic. And the ACA and CCE managed to get the Department of Health, Education and Welfare to rescind the accrediting agency's status that we were with. So we lost accreditation overnight. We lost students overnight. That was just the end. And the powers that be decided they'd let one of those three colleges survive, and that was Sherman College.
Wow.
Yeah.
Doc, what kind of what upper cervical techniques do you implement in your practice?
Yeah, initially it was HIO, but what I learned from Dr. Milton Miller, my mentor, was a neurocanal analysis. And so rather than doing the old Palmer line analysis, in the 50s, they had come up with this neurocanal analysis, which used mainly the ADP open mouth view and also the base posterior to analyze the neural canal. And so, so that's what I used for many, many years. But I have to say this, that about a year after I graduated and came back to New Zealand, there was a New Zealand chiropractor by the name of John Duggan, who had spent 6 months with Dr. Blair in Lubbock, Texas.
Nice. And
was approved to teach Blair technique in Australia and New Zealand. So I learned from him at that very early stage. And Milton Miller, my mentor, he had the whole Blair upper cervical X-ray setup with the stereo view box and all that sort of thing as well. So we had options. He would only use that with what he thought were difficult cases that he was having problems with. Otherwise, he used the neural canal analysis, and I did the same.
Beautiful. Was it difficult to have a practice, sell it, move to a different country, teach? Was it difficult to start up another practice again? How was that?
You mean when I came back eventually? Or what?
When you came back to New Zealand,
difficult?
was it and started another practice? Because starting a practice can be a ton of work, and you really got to be fired up and love what you're doing. How was that second go around of starting up a practice?
Yeah, it was interesting. See, the reason I came back to New Zealand after having been in the States, after the Los Angeles experience, I ended up in Seattle for a couple of years. And then my son, in the meantime, had graduated from Sherman, was back in New Zealand. He graduated in 96. And in 97, he said, "Dad, it's time you came back for a visit." I'd been away for 5 years at that point. And I said, "Yeah, that sounds like a good idea. You organize," because I was teaching postgraduate seminars throughout the States entitled Upper Cervical Specific for Full Spine Chiropractors.
Really?
So, yeah, I was doing that.
How was the turnout of those?
Having a lot of fun with that. So
Good.
I said, organize a seminar for me and I'll come. And in the meantime, while I'd been away, they'd establish a college in New Zealand. And so I was very keen to check that out as well. So I spent a lot of time at the college. I was here for a month, and they said, "We really need you here because it's difficult to find New Zealand chiropractors with academic experience." And I'd had experience with 2 colleges by that point. So quite a lot of experience, not only in teaching and academia, but in administration and accreditation and all that sort of thing too. So they made me an offer, and by the beginning of 98, I was back here, and I've been back here ever since. So I didn't practice for about a year after being back here. And to answer your question, a colleague decided he wanted to sell a part-time practice very close to the college. and he said, come in, we'll work out a deal. So I took over his part-time practice. So I had a core patient base, and it was perfect for me.
Beautiful.
And
Doc, how many years?
and so I've been practicing part-time and teaching part-time at the New Zealand College ever since.
Beautiful. How many years have you been in practice?
How many years now?
Yeah.
49
years.
Yep,
That is
graduated
that's pretty incredible, because I just admire anybody that's been doing any type of work, the same work for like 10, 15 years. I find it amazing, because it's up and down. There's good days and bad days, and anybody that sticks with it for that long, I'm sure when you look at where you started to where you are now, the amount of information and people you've been able to help has probably been truly amazing.
Yeah, that's for sure. It's just such a blessing that I found chiropractic. It's just been an amazing experience for me, and I've had so many different types of experiences professionally, because I've been open to that, open to change, open to challenges. That's the type of thing. I got involved with the political side in New Zealand for a while, on the association and so on, but that's not really my thing. But I did make a contribution in the 70s and in the 80s, and then I decided, no, I'm not going to do that anymore, and concentrated on academics and practice, which it's the best of both worlds for me.
Is your story a large part of your practice, why you got into chiropractic? Do you tell that a lot to your patients?
Yes, I do. And I make a point of telling patients that I'm under regular chiropractic care.
Mm-hmm.
And so is my whole family. So, yeah. And a lot of people don't realize that. It really it impresses them. Oh, you actually walk the talk, you know.
Right. Absolutely.
Hmm.
Do you ever see yourself taking a step back and removing yourself completely from teaching and doing chiropractic, or are you just doing it for as long, God willing, as long as you can?
That's it. Yeah, that's
There
what I
we
want to do. Just keep doing both.
I
Yeah,
love that.
I've been pulling back a little bit, so I just have to pace myself a bit more these days with advancing age and whatnot. But as long as I have regular chiropractic care and I look after myself from a lifestyle point of view, I think I'll be able to keep going. So it's exciting.
Dr.
And I
Graham,
just want
sorry.
can I tell you one more thing?
Absolutely, yeah.
The way I practice these days is different from what I was doing for the first 20 years. So
Really?
although I still have yeah. And the difference is this. When I moved to California, I got interested in network spinal analysis.
I'm a big fan. I've had that
yeah,
adjustment done a couple times. I like that a lot.
yeah. So network care, and these days it's just called network spinal. But that was a big wake-up call for me, because I had experiences where sometimes people would cry after adjusting, and I would wonder, you know, did I do something to hurt them? But they reassured me that no, that was not the case, but they just felt so much better for having released that emotion. And network spinal analysis, with its very light touch approach, tended to do that, to help people release more deeply their emotional state. And that was a huge aid to healing. So I got very, very interested in that, and devoted quite a bit of time while I was in the States to actually attending the seminars and learning how to do it, because it's a totally different approach to anything else in chiropractic. So I still incorporate aspects of that in my practice. And then in about 2008, 2009, I got interested in neuro-emotional technique as well, because as you well know, we're humans are physical, mental, and emotional, and spiritual beings. And I think that if you're just concentrating on the physical all the time, you're missing quite a bit of the important parts. So it's the reason I do NSA and also NET, neuro-emotional technique, is to help people hold adjustments better. And that's really
Mhm.
why NET was designed as well. So it actually, when people have repeating patterns of subluxation, there's usually an underlying emotional or stress factor that's holding things up. And I find that the most direct way to approach that is with neuro-emotional technique. It actually is something that assesses and it works directly with the physiology of emotional stress. It's not the same as psychotherapy or psychiatry. It's nothing like that. It's not a talking therapy at all. It's all about physiology.
How does
And
that
so
work?
it's really
Is it kind of like network? Is there an adjustment, or is it
it's
how?
quite there is an adjustment, yeah, but it's quite complex. It uses the meridian system. It uses muscle testing. It uses statements and things like that. But the patient, once you understand the protocol, the patient leads you. You don't push the patient along. So it's about what the body mind wants to do and what it's ready to do, which is quite brilliant
Very
actually.
cool.
And I find that it makes a huge change to people, especially helps people hold adjustments better as well, which is huge.
That was actually that's my next step in chiropractically. I want to get certified in network because I've had it done to me a couple times, and it's very profound. And they're barely touching you, if not even touching you. When you look at it from afar, it looks a little wacky and wooey, but when you get it done on you, it is a very powerful adjustment, and I feel so loose after those adjustments. Like just
Absolutely.
light,
Yeah.
just completely light.
Yeah.
I'm a big fan, and I'm definitely looking to get certified in that.
Very good. Okay.
Yeah. Dr. Graham, do you have any advice for the students just graduating that are getting into chiropractic practices? Any advice for them, people just starting out?
Yes. I guess my biggest advice is attention to detail, really, and
Mm.
also philosophy, your why.
Mhm.
Never lose sight of the why of what you're doing. That's one of the things that I have always made sure that before I see any patients in the day, I sit quietly and just tune in to why I'm doing what I'm doing and celebrate what it is that I'm doing as well. And I think that if you're on purpose, you don't get sidetracked into people's stories. You're compassionate, you're empathetic, and that sort of thing. But it's not about treating the symptoms. It's not about treating the pain. It's not about treating diseases. It's about identifying where the interferences are in the spinal neural system and being able to focus on that and being able to tell people what you do and why you do it as well. So it's about communication and also about being very specific and conservative about what you do as a chiropractor too.
I love that. Dr. Graham, where is your practice in New Zealand, and where can people find you just to maybe schedule an appointment or just to find more about you, find more out about you?
Yeah, I practice in Auckland, New Zealand, Auckland. That's the biggest city in New Zealand. And I'm listed on the Blair website. I'm listed on Upper Cervical Care website. And if you were to Google my name, Dr. Graham Dobson, chiropractor, you'd see something online. I don't have a website. I don't have a landline phone. I don't actively seek new patients. I accept
But I'm sure
referrals
they find
from
you.
current patients. Yeah, that's right. They find me through referrals. It's totally word of mouth.
Yeah, that's
Yeah.
beautiful. And yeah, I definitely plan on visiting your beautiful country in the next couple years. So I would love to see what you're doing out there and just learn a little more.
Well, it'd be great if you come and you make sure you connect with me before you do that, so we can host you. And also, love to show you our college, the New Zealand College of Chiropractic. It is really a world leader now in chiropractic education. It's I teach the upper cervical course there, have done since 1998, and we're doing great things there. I even taught a couple of Blair electives at the college as well.
Beautiful.
But we're very much an on-purpose, philosophically focused on subluxation in college.
I love that. You don't see too many of those left anymore, so it's good to see somebody still doing it.
Sure.
Doc, thank you so much for coming on. I really appreciate your time and you sitting down and coming on the show. I would love to have you back anytime. Thank you so much.
Thank you, Dr. Kevin. It's been enjoyable, and good luck. And you're doing great work there with your podcasts too, and your practice, no doubt, too.
Thank
so keep
you.
up the good work.
I appreciate that. Thank you so much.
You're welcome.